Okay, just like, so I'm just gonna go into the setting, right? Okay, everyone, good morning, everybody. Nice and early in a really beautiful sunny day. So before I start, just a quick introduction, probably been told already who I am. So I want to just thank you, Helflix, for the opportunity to speak this morning and the lovely Heather Mason and the Minded Institute. And yeah, so we're gonna have a talk about low back pain and especially about chronic low back pain. Okay, so but before we start, what I like everybody to do is just to settle for a second. And I want to give you a word of advice. If you are listening to this talk because you do suffer from back pain, don't feel you have to listen to this sitting down. Find yourself in a comfortable position. It could be standing up. And as you see, I've set up my bed behind me because you might want to listen to this talk lying down. And I will show you also a few other positions you can be in. Okay, but just let's start together. Just let's center for a moment. Let's place our feet on the ground if you're sitting on the chair, getting the sensation of your feet on the ground. And just let's take an inhale into the nose, rolling the shoulders back, and an exhale through the mouth. And getting a sense of our body sitting here all together in this space. I think in this moment of extra increase of technology, we need to constantly be aware of this exchange of information. It can be very fast. So it's just a kind of moment of arriving before we start. Okay, great. Okay, so back pain and yoga. As you probably already know, I'm a physiotherapist and I've been doing this work for a long time. And back pain has always been what I would call my field of expertise. So it's what I've been working with most of my career. Um, if we were now sitting in a room together and I will say to you, okay, this very simple question, have you ever suffered back pain? You will notice that we're all going to put our hands up because it's been proven by statistic that basically nearly 90% of the population suffer for at least one episode of back pain in their lifetime. Okay, and so that's quite a high percentage. But then at this point, we want to distinguish. Okay, so if you're there and you're listening to this because you have back pain, you want to distinguish people that have an episode of back pain and people that actually end up developing chronic pain. Okay, so in a nutshell, okay, so you can have an episode of back pain and it will last, let's say, anything between 1 week to 8 weeks. It can go even up to 3 months if there is some kind of disc issue. I'm going to try not to attach a label to this, and I'm going to explain you very, very briefly why. And that's kind of an acute into subacute back pain. Okay, so it's a fairly normal process and it happens to a lot of people. After that, we enter more the realm of what's called chronic back pain. Okay, something that lasts longer than 3 months, longer than the time then the tissue healing should have taken place. Okay, and then this kind of chronic low back pain sometimes can be recurrent. Again, I don't know who is listening, but if you have had episodes of pain that then is kind of settled, but then it's kind of came back. Maybe some people come to me and they say every 6 months. Some people come to me and say, well, once a year I get a really bad episode. Another thing that tends to happen is that not only is recurrent, but the episodes become closer in time or more intense. Okay, and that's a really common thing that happens with pain in general, and especially with pain coming from the lower back. Okay, so again, just really briefly, a lot of people that suffers from back pain feels that they need investigation, and they feel that there is a structural problem attached to it. And actually, out of this percentage, we have discovered that around 80% of people with back pain have got no pathology attached to it. Okay, what do I mean by that? Yes, okay, you will have an episode of back pain and there might be some tissue damage, okay, of a known cause, non-specific. It could have been muscle tightness, a muscle pull, a muscle sprain. We could be talking about, yes, we could be talking a disc structure, like, something like a disc herniation or a prolapse. And here I can go into a very, very long conversation about what that means and the language we use around that. But I'm not going to, because that's not why I'm here today. So we're here for 30 minutes. So I'm making a decision of what I'm gonna focus my attention on. So yes, we do have something that happens, but however, this can be very non-specific. In our quest for a diagnosis, and I am guilty as charged because I am the same, I always want to know what's going on. We sometimes leave behind what happens actually in the whole body, okay? So when we search for an MRI scan, for an X-ray, for a precise diagnosis, what we don't realize is that a lot of people that experience back pain, a lot of back pain is non-specific, which means it's coming from somewhere that is impossible to pinpoint. Even if you got an MRI and that MRI shows a disc herniation or what's called disc degeneration, they're going to tell you a lot of stuff. This is why we do not like us, a professional. We don't like, unless it's necessary, send you for an MRI scan. Because sometimes we get very, very attached to that diagnosis. However, what we found via research and a lot of studies is that some people will have a disc prolapse and no pain attached to it, nothing, yeah, nothing, no problem, maybe a little bit of stiffness. And then some people have a lot of pain attached to a very small disc prolapse. So it's very hard to attach what we see on MRI versus the pain experience. So here it gets complicated and actually really simple at the same time, is that what brings that pain experience, okay? Now, bearing in mind that if you're sitting there and you have a lot of pain and a lot of nerve pain or radicular pain, which is sensation on the leg, you might need to see us, see one of us, one of the physio, talk to us or see a doctor. But in the case of this recurrent, non-specific back pain that stays in your back and really taint your experience of life, sometimes what has happened is that the relationship between your sensation and your healing process and the nerve pathway has changed, okay? And therefore, it's becoming something like a really loud experience that you need to work with. And this is called like central sensitization. It's nearly like where your pain feel bruised. So like you will have pain, give an example, located here in the lower spine. And actually, it's to the point where not only it's painful if I bend, it's painful if I extend, it's painful if I sit, it's painful at night, is not responsive to medication. These are all like bells, the kind of sign chronic pain. It's painful at touch, the lightest of touch. Is that phenomenon known as central sensitization, where it's nearly like a relationship between the area and the brain is going to be out of control. You're creating a pain pathway, a pain experience. And one thing we know is that pain and emotional state have got a huge relationship. So, and it's just that emotions, it's not like a pain is in your head, and I want to really make sure that's not what I'm saying, is that your emotional state and the pain experience feed off each other, okay? So you will have an episode of back pain with structural damage, But if you have had pain before in that area, the memory of that will increase the messaging from the brain to the area. So your pain experience will be bigger. And another thing that can contribute to that, of course, you will got lack of sleep or insomnia. We will have emotional experiences, like depression, anxiety. It can be as anxiety directed to the pain. So I have pain, therefore I won't be able to do such and such, and the anxiety will feed off the pain. And this is why I find that we need to be more individualized in our approach to back pain. Okay, and the one size fits all approach to back pain has not worked. We need to understand who is the person behind the back pain. You need to understand who you are behind the back pain. And I find the yoga therapy is quite complete in that. I was always thinking, why is yoga so good for chronic low back pain? And it's because we are approaching back pain from all different angles. We're looking at the emotional state behind the back pain. We try to address the lack of sleep, because if we don't address that via medication, by the way, but also via some techniques, we cannot release the back pain. We cannot lower the pain experience. Addressing the anxiety and emotional state and the depression will help. Okay, so like dampening down the pain experience. And then we need to reintroduce movement. And I think that's, again, where yoga is really good at. I can give you like back stretches, which I'm going to show you now, that are very typical for an episode of back pain, especially acute. But the real good approach to chronic low back pain is an introduction to what's called gradual and graded exercise. And what does that mean? Okay, so what that means is that we are going to introduce movement very gradually and very graded. Somebody once told me this, and it was a physiotherapist, quite a popular physiotherapist in my field, and it's something called the Goldilocks principle. And it goes like that. So you can introduce movement, and you have to be careful that it's not too hot. The porridge is not too hot and it's not too cold, but it's just right. Okay, that's the principle of grading the exercises and movement. So you don't want to go straight away. I have had back pain. The physio told me I need to move, and I'm gonna go for a 10 miles walk today because it's really sunny. And then that's too hot. It could potentially be too hot, and I'm gonna be in pain for 3 days, and I'm gonna jump back in. But then I'm only gonna do 10 steps between here and my house, and that can be too cold and not really challenging anything. And it's finding that just right. It takes a lot of experimenting. Okay. So I think in a 30-minute talk on such a complex subject, if I have to come down with what we should really be focusing on, I will say some sort of mindfulness practice, really, really important. Either a body scan or a mindfulness for breathing practice, and then some self-compassion practice or a mindfulness-based stress reduction practice. So these are the practices that could be very, very useful to help with your chronic low back pain. And they have to be introduced gradually, because I don't expect now that you go from never have done anything to sit and meditate for 30 minutes. So just kind of very small practices, starting really gentle. Again, to just dampen our pain response. And then graded exercise, and start challenging and stretching the structure to start bringing some changes. And then once that is done, introducing strengthening and functional exercises. So introducing some strengthening to bring some power into the body, and trying to go back to some sort of normal experience, and then functional to actually being able to feel better and more embodied and more at ease with ourselves. So that would be like my plan. my plantar shell, and it will work in different ways for different people. A degree of patience with this works. I read a good example. So we're gonna start with a very small body scan and mindfulness practice. And before I start, I'm going to tell you this example while we're doing this. So imagine you're like, I was going to say a cat. It's going to sound really cruel. Okay, imagine you're a cat and you have tied to this cat a lot of tins, a lot of tins of beans. And the more the cat moves and fights this, the more noise these tins make. So what we're going to try to do now is we're going to try to make the noise a tiny bit less loud, a tiny bit less agitated, so that we can start kind of coming down more into the body, okay? And then we're going to do some exercises, which are like very, very typical, maybe not individualized, but for individualized, do feel free to contact your professional, your physio, or your physical therapist. So, okay, so let's start in a quiet space. So I usually suggest that people do this in sitting on a very comfortable chair. You need to be able to sit nice and upright. If you want, you can place a pillow behind your back, just here, just to support the lower back. But you do want to have your feet on the ground. You want to have your feet on the ground and able to move the pelvis. So you want to have the freedom into the pelvis so you don't feel stuck at the back of the chair or too forward and just really not ease. I'm going to show you here. So if you think that that's not possible, and actually sitting, it really does not work for everybody, feel free to lie down on your back. And what you can do is just listen. Don't feel you have to look at the screen. Okay, just kind of close your eyes and just listen to my voice. You're going to lie on your back, and you can, one good position is, let's call the relaxation position. So you have your feet on the ground, your knees pointing up towards the ceiling. Your pelvis is relaxed. You can put again something underneath your back if it feels really tense. Or if you actually are experiencing a lot of pain in this position, try something bigger here. And let your feet drop a bit to the side. Let the hips open in this position and let this area really relax. Arms down by your side. And just take a couple of breaths. I'm going to come into sitting to do this one. So we're going to just stay here for a few minutes. Okay. And you can close your eyes or have your eyes just cast down. And just bring your attention to your breath, to your inhale. So the air entering your nose and your exhale. Bring your attention to the sounds outside. Maybe the sounds of nature, or the sounds of your household. And then just bring your attention to your body, to the sensation arising in your body. And try not to attach any judgment. Just simply notice with a sense of curiosity what's going on. If your attention wanders, just bring it back to the breath, to that experience of inhaling and exhaling. And then bring the sensation to your feet. So if you're sitting, to your feet on the ground. If you're lying down, the contact of your feet to the earth. And any sensation that might arise, how do they feel? Then you just travel to your knees, your right knee and your left knee. And you can focus to the external sensation of the skin and the air around it and the environment around it. And then you can bring that attention at a tiny bit more internal sensation, at the happenings within the body. And just notice. And then we travel up towards the hips. And you let this inhale and exhale travel with you into this experiential journey. Into the pelvis. Into the lower back. And then bring that attention if there is any discomfort. And what arises when you bring your attention there. And see if you can then refocus on into the texture of your inhale and exhale. And maintain the curiosity as you notice the sensation arising for your back. And then travel into the spine. The shoulder area. Up the neck. The front of the throat. Releasing the jaw. Softening the area between the eyebrows. Softening the eyes within the eye sockets. And then slowly just come back. Again, if you're lying down, feel free to bring your knees to the chest for a moment. Stay lying down if that's comfortable. Stand up if that's comfortable. And just come back 1 second into the space. So these kind of things are like mixed experiences between mindfulness of breathing and body scan. And it's just to bring the attention to the area that, in a way, we don't want to bring the attention on. So you can use a smaller amount of this, just kind of just do mindfulness of breathing, just simply set into your body and do the breathing. And you could just do the mindfulness of breathing just by counting the breath. Or you can do more like a body scan experience where you really feel the sensation, feet, knees, lower back, spine, shoulder, working up. You can work it down. There is other techniques which are very interesting for low back pain, which is focusing on a part of the body, for example. I could have done that. Focusing on a part of the body that feels okay. For that, I'd rather be with the person and then move on to the part of the body that doesn't feel and see the experience that arises with that. But that's a tiny bit more tricky. I find mindfulness-based compassion very useful when it comes to low back pain. But then again, there's something else that can be discussed another time. Okay, so the importance of releasing the nervous system, kicking off the parasympathetic, or simply bringing attention to our body experiencing, it cannot be underestimated, okay? Because unless we calm down the nervous system in chronic low back pain, it's very difficult to damp down the pain response. To just attack the body with a lot of exercises can be counterproductive because it does not change the central sensitization. It does not change the relationship between the nervous system and the area that is in pain, that as at the moment could be dysfunctional, not reacting to the healing process the way you will expect it to. It is not a quick fix, and it just takes a lot of time, a lot of practice. But you might find that by calming down the nervous system, you're already feeling less pain and less anxious. So before we start some stretches, I'm going to show you typical back stretches we do that I advise people to do a few days after an acute episode. So let's say you have a relapse. Very typical back stretches, which are very similar to a lot of yoga stretches we use, and then a couple of functional things you can do. Another thing to say is, like, I don't know if people are experiencing more pain now, because another thing that has happened in the last month is that we've been all locked in a very different environment. So two things would have happened. We either have a tiny bit less pain because we are not driving to work, we are not sitting all day long, or the anxiety of the situation and the anxiety of everything that is happening, which is massive, has created a tiny bit more sympathetic response into the body. Therefore, we're a tiny bit more in flight and fight, and our pain response is going to tiny bit more agitated. So either way, these techniques will work. So let's start with lie down spinal stretches. So what I want to do in the next few stretches is I want to release the area around here. Okay, so I want to really soften around the pelvis. So I want to do few of those movements. I don't want to tense around here, none of those like tensing the muscles. It's all another conversation about core stability, which I don't have the time to do. But try not to brace, okay? Try not to feel into the sensation. If you're bracing, you're doing good for the body. You are not. You're very possibly increasing the pain response by bracing and telling the body that there is something to be scared of. So what I want to, as we are lying down, is softening around the belly area. So the breath, see if you can direct the breath into the belly and soften around here and try to bring some movement into this area. I do not recommend that if you have had now an acute episode 3 days ago, okay, you jump into these exercises. I actually tell my patient, if your pain is starting, let's say, what's the Tuesday, on Saturday, and you can, take some pain relief, hot water bottle, ice, and just move, pace, walk. Every 10 minutes, sitting down, standing up, go for a walk, have a cup of tea, don't sit too long, don't lie too long. That would be my advice. Let's say a bit more has passed, or you are in that chronic episode. These are fine. So we're going to lie on our backs. Let's hope you can see me, right? And we're going to start We're going to start with our knees bent. I always recommend people, especially if you've got pain a lot here in the small part of the back here, or sacroiliac joint stuff, that you keep your knees bent and refrain from this kind of lengthening here. So knees bent, soften through the belly. You can at this point do a tiny bit more breathing, really just lifting the belly and releasing. And then you can use the breath to guide the pelvis as we soften. Don't be tempted. That's the point where everybody braces. Do not. So soften here, but tilt back. And then exhale and release forward. As you travel back and forth with the pelvis this way, try not to overdo it, okay? It's tempted. It's not the more, the better. Remember what I said about the Goldilocks principle, too hot, too cold, just right. You might need to experiment. You might need to do 3 and see how you feel today, okay? I say that to people. So it might just be that you go like, right, I'm going to do a few of this, and then I'm just going to give it a couple of days. And I'm going to see how my body reacts. If your body goes like, yeah, it's fine, actually, really enjoyed that, back on, do a tiny bit more. Gradual, graded movement. So, the same for fatigue. You don't want to go, oh, today I feel good, I'm going to do lots of stuff, and then you crash down for the next 2 weeks. Gentle. So we're going to do this pelvic tilting, yeah? And then I don't know if you can see it. I'm going to firmly plant it, and let's take my shoes off, which is weird. I don't know why I got my shoes. So you're going to firmly plant the feet into the mat or the bed if you cannot get down to the floor. And I am going to imagine I got a string on top of my right side of the hip here, pelvis, and my left, okay? And I'm going to push this way. Exhale, inhale. Yeah, so I'm going to lift. Imagine I'm lifting my hip up, but I'm not. And down. The best way I can describe this, you're doing salsa, but lying down. Down, down. So that kind of really the pelvis. And you can make this very soft with the breath, experiencing. So you're pushing, lifting, pushing, lifting. And then you're going to imagine you're going to send, again, this should be done really, really slowly. You're going to send your right knee away. So I'm like shifting and in, shifting, shifting. Yeah. So I'm kind of go side to side, back and down. And then I'm going to retilt back and forward, just the pelvis. And maybe peel the spine, a couple of vertebrae, and down. So we're going to peel the spine up and down. We're going to start this way, you start bringing some strengthening in the movement. So here we are already stepping up, okay? So you peel the spine. See if you can feel the segment of the lumbar spine like pearls really down into the mat. And then you arch and then you peel. Lovely. And then we bring the right knee, one leg at a time, please, to start into the chest. And as you bring the knee towards the chest, if you can press the pelvis a bit and forward. So there is that kind of relationship here. So we are really working on stretching the back. So before we were stretching the QLs and opening up the QLs. And here we're going to go a tiny bit more into the spine, into the lumbar segment. We do that both sides. We can do both if you're feeling good. You can go side to side here. And then that's another one. So again, if you have a lot of pain, you probably want to keep both feet to the ground. You drop both knees to the right, turn your head to the left. Here, I suggest when you get to the destination, you really breathe into the belly. Okay, try not to lift the shoulder blade. Try to let just the leg drop to the side. There's not this kind of really crazy stretches you see. Feet on the ground and just drop. And then a tiny bit here of tummy, but very gently, pelvic floor, if you know what it is, and then bring it back to the center, but then soften again, and then drop to the other side. So that's kind of your basic one of side to side. And I find this really beneficial. However, for some of you, there might actually be, if you don't have a lot of pain, you're recovering, I find actually crossing my leg over and then dropping is a tiny bit stronger. It's nearly like a manipulation we do in clinics, like you're becoming your own physio. So be careful with this one. Cactus shape arm or open to the side, and we drop. So, but again, this can be pendiculated. Yes, so it can be just back and forth. Or it can be held and softened. Or a mix of the two. So pendiculation, so in and out, and then back there, and really soften around the area with the breathing into the belly. And obviously both sides, always useful. And then you want to roll over to the side and stretch here. So when we stretch here to the side, a nice big stretch here, bottom leg bent, I lengthen this leg away, and I see if I can open this side. And then I'm gonna bend it, and here. Now this is a position where I do a lot of strengthening, but I think the strengthening will have to be another chapter of this conversation. But at this point, graded exercise, you might decide you still got space for more, or there's another set. So you're probably very familiar, all of you, with child pose. It's a really lovely position to do if you have back pain, or your cat stretch. And again, you can try to experiment here by really breathing in the belly, really softening around this area. And just really working in bringing these movements back. Another thing that happens a lot with chronic low back pain is that we stop moving from here. Let's say you had a diagnosis, I'm talking about like just guessing here, but, or this prolapse long time ago, or the pain came because you were flexing forward. You stop the movement, you go better, but actually you're always a tiny bit tight or tense around here because you never regain the confidence to bring the movement back. So these are good places to explore the movement. Remember, our spine is very strong. The discs are really strong. So you can experiment with this stuff. And these are good places to do it. So you can go down and play around here, or just stay really small and just play with the pelvic tilt and the softening of the belly. Or you can go tiny bit bigger and explore the floor as you travel through the space and let the spine ripple. And with this, you can become more comfortable and confident with time, and use again the theory of graded exposure, which is you do a couple, okay? And then you see how you feel. And then if you flare up, okay, fine. Take some medication or put an ice pack on it, let it settle, and go back to it again. And slowly you might find that that ability to manage increases. But now let's imagine that you cannot do those. Well, you can do this in standing. Okay, so the standing still works. So you could use, I'm going to imagine this is a wall. Okay, so imagine you're lying against the wall, so you can't bend your knees. You will have your knees bent a little bit. I only got a few minutes left, I'm afraid. So I've got so much more to say. So you can't practice that pelvic tilt, because not for everybody is either possible. Although now we are all working from home, so this is possible more than before. Yeah, it's much better than the office, right? But also it might not be available physically to you, the floor, you know, hip replacement, knee replacements, other mechanical stuff. So the wall works perfectly well to do this pelvic tilting, these cat and cow stretches. And you can do lovely roll downs, which I really like more than forward bends that we use a lot in yoga. I find the roll downs are a tiny bit better for back pain. So you bring your chin down to the chest, your knees are bent, you're rolling down. So you're rolling down to the knees. So let's see if you can see me more this way. That's it. Rolling down to the knees. The wall would be behind me, right? And then you take an inhale, surrender the head, exhale, roll up, stack the vertebrae on top of one another, roll back, inhale, exhale, roll down to the shins, to the floor if you want to, but you don't have to. You can do your cat here, yes, again with the wall behind you. You can do your downward dog, another really nice one to do. Obviously not a wobbly chair like this one. Yeah, please use the wall or a very sturdy, maybe the sink. Knees bent, and then you walk yourself back. And the stretch should be felt here, but you can just play around here, and it's really nice. And then you walk back. And actually, I'm just realizing I'm completely run out of time. I want to finish with this one though. So just gentle stretches. I recommend everybody to start. Let's say if they are out of an acute episode and they're getting a tiny bit better, we're doing some chair pose, very basic chair pose, and trying to increase them. Start with 2 a day and trying to increase them daily to a point of doing like even 10 or 15 of those. So what you want to do is soften the belly, bend the knees. So as you bring your knees forward, you bring your bottom back. Imagine you're sitting on a chair, and it might just be at the beginning. That's all you can do. Can you see that I'm really freeing up the pelvis as I bring it back and freeing it back in? So there is that kind of movement here. This is the beginning of my functional movements, the beginning of bringing back functionality. Because we squat all the time. We need to squat for life. We squat when we sit, we squat when we drive, we squat when we put clothes in the laundry, we squat when we pick our kids up, when we collect things, when we put things in cupboards and down. So bringing back that squatting is really important, and putting it back to a point where we feel really happy that we can do it strongly. So we got that power and control through the legs, and we can bend and straighten it in a good way. It's really important. So, right. So you got a tiny bit of stretches. You know body's kind of mindfulness can help. I cannot understate enough how much is important to look after your entire being for low back pain, from sleep to self-care, to emotional state, to good nutrition, to extremely good hydration, vitamins and supplements, good food. So it's a big thing. You need to look at everything around you to help with low back pain, not simply mechanically at the spine. Okay, so I am going, and so I have a lot more. So to finish this, I got a lot more to say about this, of course, as you can imagine. It's a little introduction to the complexity that is low back pain. If anybody that is listening right now, I'm going to just say this for 2 seconds, and is interested to know more, I do run actually workshop for yoga teachers on low back pain. And I'm going to do one for the Minded Institute, so keep your eyes open if you're interested. And the one thing that I haven't touched today is core stability. And I know if anybody's listening that has had back pain, they're probably really curious to know about strength and core stability. But it's such a long conversation. It has to be done in a separate talk or place. But do feel free to contact me, okay, if you got any question, and you will find me through the Minded community. Okay, so I got one question before I pass over to, so one question here. When I do some vinyasa class, the question is, sorry, when I do some vinyasa classes, I suffer severe back pain the next day. While doing the class, I am not aware of any problems. Should I stop vinyasa? It's a really good question. Thank you for asking this one, but it's a really complex question. In a nutshell, it is possible, and I'm gonna overshoot here. So one thing we didn't speak about, I didn't go into structural today. So thing that happens a lot to yoga teachers. There are two things that happen to yoga students. One is the hypermobility, so extra flexibility, and the other one is sacroiliac joint problems. Vinyasa flow, vinyasa classes, a lot of yoga classes done in a flow method tend to put stress into the ligament of the sacroiliac joint, okay? Because we tend to do, see if I can show you very quickly. See, it's all about alignment. If the pelvis in yoga sometimes is asked to do things where we twisted it, all the warrior poses, all the trikonasana, all your dancer poses, even three, where we open the hips, we put stress through the sacroiliac joint and stress through the lumbar joint. I'm trying to step away from mechanical, but there is some mechanical stuff. Right. So if you don't have pain before and you're pain during it's not during the class, but afterwards, it means that you're stressing, possibly stressing those ligaments. Don't stop doing vinyasa. You just need a couple of modifications. Don't stop your yoga practice. It's so important. So please find someone. I'll be happy to do it, but it doesn't have to be me. Find somebody that can look at a couple of things you do. It probably can be your warriors, or you can be stepping in and out, or you can be your downward dog. Something you're doing is triggering the spine. With a couple of correction and learning them, you can enjoy your vinyasa flow, possibly pain-free. Okay, so don't give up yoga. You just need to modify some posture and you'll be fine. And yeah, some teachers will be really able to guide you. Donna Fari speaks a lot about this, okay? Feel free to ask me questions another time if you want to. So there is another question here. When I have low back pain, do I put on hot or cold patches? Again, really good question. Depends. It depends. On a physiological level, they create the same sensation. So they alter the sensation and then bring some blood flow to the area. Now, scientifically, they have said that they don't do anything, but I don't agree. So I think, as a general rule, okay, some people respond better to ice than to heat. However, if you have radicular pain, and that's pain that is come from a neuropathy, so something that is something to do with the nerves, ice could trigger it and make it worse. General rule. If you have something more osteoarthritic, heat is better, they say. However, I will experiment if I was you and see what your body does better with. So try 10 minutes of ice and try 10 minutes of heat. Alternate them. Some people find that better. You will have to find out what works for you. So unless it's a radiculopathy, so nerve pain down the leg where ice doesn't work, either way will work. Okay, it just depends what your body, you will prefer. Make sure if you ice it that you cover it with a towel because it can burn you. 10 minutes, if you do alternating, 10, 10. Okay, 10 minutes, 10 minutes. Otherwise, 20 minutes about a couple of times a day. For an acute episode, ice. Go for ice. Okay, so I think, yeah, I think that's more or less it. So I am gonna pass this over to Leah, and I'm gonna say goodbye for today. And like I said, I mean, this is a conversation that can go on forever. We didn't speak about obviously strengthening core stability and increasing and people that run and people that are very, very physical. There is so much to say about this. But do feel free to post us any question and we will be happy to help you. Okay, take care everybody and have a lovely, oh, there is another one. And have a lovely, thank you. And have a lovely Tuesday, right? Yeah, okay. The days are a bit blurred at the moment. Right, take care. Bye. Bye-bye.